Thank you very much, Mr. Chairman. I want to thank, of course, all of our witnesses as well for being here. We all care deeply about the work of this select subcommittee. I think it's critical, and we all can agree that we learned as much about the COVID-19 origins as we can. We know that preventing future pandemics saves lives. That's what this is all about. That's what this committee is all about. We've lost over 1 million American lives in this country, many more across the world. A lot of folks know I lost both my mother and my stepfather to the pandemic early on, so I understand the human cost and tragedy of this virus. I'm very grateful that in May 2021, President Biden ordered the intelligence community to investigate the origins of COVID-19. He specifically requested the Department of Energy be brought into as part of this important assessment. This has been discussed today. We know that this is critical work that's been happening. We also know that one way or another, we don't have clear proof about the origins of COVID-19, and this has been shared by our witnesses and, of course, in the many reports that have been produced by our agencies. Now, we can make convincing cases, of course, for both the potential lab leak or if there was transmission from animals, but no one can say for certain where exactly the origins are today. And I think I want to repeat that so that it can be very clear to the American public as far as where we're actually at in this process and in these investigations. Multiple federal agencies have supported both sides of the question and none with high confidence. One of the most important lessons that we can learn from the origins of COVID-19 is how we can better respond to future viruses and future pandemics, because there will be future pandemics. We've seen the mass death, the devastation this has caused our economy and the American public and the global public. And we also need to know and understand what mistakes were made in the past so that we can correct them in the future. We know, for example, that President Trump's own advisor in COVID-19, who we heard a lot from during the pandemic, Dr. Birx, had said that the previous administration's policies early in the pandemic possibly cost us hundreds of thousands of American lives. And I want to also note something that was said. We know that on more than 20 separate occasions, President Trump defended President Xi and his handling of COVID-19. We've been talking a lot about China and Chinese origins, so it's important to talk also about what the former president's comments were. So even as we had concerns about China's lack of transparency early on in the crisis, President Trump would consistently praise President Xi, in fact, on 20 separate occasions. I want to quote something former President Trump said, quote, "Last night I spoke to President Xi. We talked about the experience that they had in China and of all the things that have taken place. And we learned a lot. They've had a very tough experience, and they're doing well, and he's doing well. President Xi is doing very well. But we learned a lot, and we have great communication together. We're going to be sent great data from China," end quote. Now, it's very clear that that great data actually never came, and there was never really the cooperation that the former administration said that we were going to have. And over again, President Trump's administration coddled the Chinese government and told us that this was all going to work out just fine, even though his doctors and scientists disagreed. If members of this subcommittee are as concerned about the role of the Chinese government in the origins of the pandemic, then we also need to take a serious look at why the former president repeatedly praised China and downplayed a virus that was gone on to kill over 1 million Americans. That is the work that the subcommittee should also be focused on. Dr. Redfield, I know you mentioned in a New York Times interview that your greatest disappointment was lack of constant public health messages from civic leaders. And so my question is it fair to say that misinformation was a major public health threat?
I think that getting accurate information to the American public was really important. I was extremely disappointed as CDC director that I was restricted from being able to communicate to the American public. I thought that was a disservice.
And do you think that politicians who spread misinformation make the pandemic worse? And would it be fair to say that politicians who promote vaccine hesitancy actually cost lives?
I think that there's a number of issues. Clearly, vaccine hesitancy is one of our greatest threats. As you know, as a CDC director, I took it on head on when I found out that, we had over 360,000 people die of flu in the decade before I was CDC director, and less than 50% of American public takes the flu vaccine. So try to get over that. I do think, and this is different, I do think one of the ways you promoted vaccine hesitancy, though, that wasn't the intent. I do think when we got into vaccine mandates, that helped reinforce vaccine hesitancy. So vaccine hesitancy is a threat. We need to address it.
Thank you very much, sir. And I think that's important to also note, because vaccine hesitancy has been promoted actually by some members of this committee, is actually very dangerous, as has been said by you and many doctors across the country. Yeah. Just quickly, Mr. Redfield, according to your March 17th, 2022 transcribed interview with the Select Subcommittee on the Coronavirus Crisis, you had a team of CDC investigators prepare to go to China in early January 2020. Is that correct?
Correct.
But President Trump was not successful in deploying this team to China. Is that also correct?
Correct.
Well, thank you very much, Mr. Chairman. I yield back.